Steve Thurmond here with Medigap Tennessee, your source for Medicare Supplemental, Medicare Advantage, prescription drug, and dental plans in Tennessee. As they grow in popularity, I often get asked about Medicare Advantage plans. They appear very attractive upon first glance, but there are a lot of gotchas to be mindful of. So this video will be outlining some of the pros and cons of these managed care plans that are being offered by more and more companies across the nation. First, a little history on these plans. Since 1966, Original Medicare has been the main option for healthcare coverage for seniors in this country. Shortly thereafter, many insurance companies started offering Medigap plans, also called Medicare Supplemental plans, to pick up the other 20% that Original Medicare does not cover. In the 1970s, Medicare beneficiaries also had the option to receive their Medicare benefits through private health plans, mainly HMOs, as an alternative to Original Medicare. These were called Medicare Plus Choice plans. Then the Medicare Prescription Drug Improvement and Modernization Act of 2003 renamed them Medicare Advantage, and this is what they're presently called today. Medicare Advantage plans are not supplemental plans. Medicare Advantage plans are not Medigap plans. Medicare Advantage plans are not secondary insurance plans. Medicare Advantage plans are managed care plans that are often referred to as Medicare Part C. Medicare Advantage is a U.S. health insurance program of managed health care that serves as a substitute for Original Medicare Parts A and B. That is, Medicare Advantage plans replace Original Medicare as your primary health care coverage. In other words, you cannot have Original Medicare and a Medicare Advantage plan at the same time. You may only have one or the other. If you choose to go with a Medicare Advantage plan, you will not have Original Medicare as your primary coverage. Medicare Advantage plans are comprised of PPO plans, which stands for Preferred Provider Organization, and HMO plans, which stands for Health Maintenance Organization. While I typically don't recommend Medicare Advantage plans as a first choice, they can be a good fit for certain individuals. Let's take a look at the pros and cons of these managed care plans so you can make a better decision regarding this option for primary coverage. The pros. Number one, by law, Medicare Advantage plans have to cover everything that Original Medicare covers. So you know you're getting the same level of coverage as you'd get if you just had Original Medicare. Also, there are many Medicare Advantage plans in the market that are zero premium plans. That means that some Medicare Advantage plans in the market won't cost you anything extra on a monthly basis. Number two, Medicare Advantage plans often cover extra benefits that Original Medicare doesn't cover, hence the word Advantage. It varies from company to company and from plan to plan, but these extra benefits can be things like preventative dental coverage, yearly allowances for glasses or contacts, fitness or gym memberships like Silver Sneakers or Silver and Fit, and a monthly or quarterly allowance for over-the-counter products such as vitamins, first aid supplies, skincare products, etc. Number three, all Medicare Advantage plans have what's called a maximum out-of-pocket. This is just what it sounds like. It's a maximum out-of-pocket expense that you can't go over even in a worst-case scenario. For someone that has just Original Medicare without a supplemental plan, they are responsible for the other 20% that Original Medicare doesn't cover. And there is no limit or cap on that amount. With a Medicare Advantage plan's maximum out-of-pocket, you at least have a bit of a safety net there in the event you find yourself in a catastrophic medical situation or an extended stay in the hospital. For most Medicare Advantage plans, the maximum out-of-pocket cost ranges from about $4,000 to presently no more than $6,700 maximum out-of-pocket cost per year. This is certainly a better scenario than finding yourself on the paying end of a $100,000 hospital bill that you have to pay 20% of. $6,700 is much less than $20,000, so in this regard, a Medicare Advantage plan is certainly better than having just Original Medicare. Number four, you can enroll into a Medicare Advantage plan regardless of almost any health condition you may have. The one exception being ESRD, which is end-stage renal disease. That being said, there are only certain times that you can enroll into a Medicare Advantage plan, such as during AEP, the annual election period of October 15th through December 7th, or when you initially start your Medicare Part B benefits. There are some exceptions to this rule depending on whether or not you receive extra help from Social Security for your drug costs, or if you receive Medicaid benefits from the state, such as TennCare or the pink QMB card. Number 5, drug coverage. While there are Medicare Advantage plans without drug coverage, there are also many that do include drug coverage at no additional cost. These are called MAPD plans, Medicare Advantage Prescription Drug Plans. They usually have robust formularies, and most have zero deductibles to meet annually. These MAPD plans essentially combine your Medicare Parts A, B, and D, and again are referred to as Medicare Part C. Sounds great, right? Well, let's also take a look at some of the drawbacks. Here are a few cons to having a Medicare Advantage plan. Number 1, you still have to pay your Medicare Part B premium. Just because you're substituting original Medicare with a Medicare Advantage plan doesn't mean you get out of paying your Medicare Part B premium, which is currently $121.80 per month unless you're getting a state subsidy. In that case, it could be lower, or unless you're in an upper income bracket, in which case it could be higher than $121.80 per month. Regardless of which Medicare Advantage plan you choose, you'll still have to pay your Medicare Part B premium each month. This is so Medicare can pay your Medicare Advantage plan company to administer your health care coverage. If you haven't figured this out already, it's called having a middleman, or to be politically correct, it's called having a managed health care plan. Medicare pays the Medicare Advantage plan company, and the Medicare Advantage plan company pays your medical bills and handles every aspect of your health care coverage. Number 2, networks. The nice thing about original Medicare combined with the Medigap plan is that you can see over 95% of doctors in the United States and not have to deal with any networks. This gives you the ability to travel freely about the country and rest assured knowing you'll be able to see a doctor in most any given city or town in the United States. Conversely, all HMO Medicare Advantage plans have networks to deal with. Is your doctor in network? Will they stay in network? How about your specialists? How about your hospital? Sometimes there's no issue, but when there is a network issue, it can be a real hassle to deal with. If you go outside of your HMO plan's network, your Medicare Advantage plan will not cover you, and because you no longer have original Medicare as your primary coverage, you will pay full price for any services or procedures you receive. Even the PPO Medicare Advantage plans have preferred provider networks. Yes, you do have the option of going outside of the PPO network, but you'll pay up to 50% more, and it's up to the doctor if they want to accept your particular PPO plan as payment. If they won't accept it, you'll be paying full price there as well, just like with an HMO Advantage plan outside of network. Number 3, referrals. Not all, but most of the Medicare Advantage plans in the market require referrals to see a specialist of the plan's choosing, not your choosing. This is the main reason they're called managed care plans. It's a way for the insurance companies and medical providers to manage costs and care. This is great for them, not always great for you. Do you want to see the best specialist in your market, or do you want to be stuck with the one your primary care physician has to refer you to? Also, referrals take extra paperwork and time and often prolong your much-needed specialist visit by days or sometimes several weeks. Are you okay with waiting around for an urgent test, consultation, or procedure while your primary care doctor handles paperwork for referrals? Number 4, copays and coinsurance. With the exception of special needs plans that are exclusively for those with Medicare and some form of Medicaid, such as TennCare or QMB, all Medicare Advantage plans have ongoing out-of-pocket costs. You'll pay copays for primary care physician visits, specialist visits, urgent care visits, and the big one, hospital visits, which can cost you upwards of $300+ per day for the first 4 to 6 days you're in the hospital. Add to that large copays and coinsurance for things like advanced imaging, such as CAT scans or MRIs, x-rays, blood work, labs, tests, diagnostics, ambulance rides, the list goes on. And this is where things can add up quickly to that $6,700 maximum out-of-pocket cost each year that I mentioned previously. Don't let the $0 premium per month plan fool you. They always get their money one way or another. Number 5, stability. Between coverage, copays, benefits, and networks, these plans change in some or all ways literally every year. Sometimes for the better, but sometimes for the worse. If you're okay with your plan being in flux annually, or okay with your plan's company possibly being bought out by a competitor, and your plan just vanishing into thin air, then you should be fine. If you like a product that's a bit more stable, there are absolutely better options than Medicare Advantage plans. Generally speaking, I always recommend sticking with Original Medicare, picking up a Medigap plan for the other 20%, and then adding a standalone prescription drug plan for your medications. But some individuals simply cannot afford the extra cost of a Medigap plan and a standalone drug plan together. In those situations, I do recommend going with a Medicare Advantage plan rather than having just Original Medicare as your only coverage. You have the added protection of that maximum out-of-pocket safety net, and the included drug plan and extra benefits Medicare Advantage plans provide can be a real asset if you're on a tight fixed income. If cost isn't a huge concern or you simply want the best coverage, Original Medicare with a Medigap plan and a standalone prescription drug plan is simply the best coverage your money can buy. It gives you the best options for doctor and hospital choice without having to worry about networks or referrals, and adding the small extras like dental coverage and a gym membership isn't terribly expensive. If you'd like more clarification on these plans or want to know all of your options, just give us a call for a free no-obligation consultation. We are the source for Medicare Supplemental, Medicare Advantage, prescription drug, and dental plans in Tennessee. Remember, Medicare doesn't cover everything, so call us at 1-800-431-5431 and let us help you zap the gap.